World Sickle Cell Day is an annual observance held on June 19 to raise global awareness about sickle cell disease. The day serves as a platform to educate the public, advocate for improved care, and support individuals and families affected by the condition. According to the Africa Health Organization, majority of children with the most severe form of the disease die before the age of 5, usually from an infection or severe blood loss. And as of 2021, countries such as Cameroon, the Republic of Congo, Gabon, Ghana, and Nigeria have a prevalence rate between 20% to 30%, while in some parts of Uganda, it is as high as 45%. This year, awareness is being created on the need to build and strengthen the global sickle cell communities, formalize newborn screening, and the life-saving essence of knowing your sickle cell disease status. I am Keminni Amanor, and you're welcome to the square. Joining our gathering today, I have Fatima Oyawoye. She is a sickle cell disease warrior and advocate. She's joining us from Bristol in the United Kingdom. We also have Patrick Eneche, who is co-founder of SAMVIC Eneche Health Trust Fund. He's joining us from Abuja. A little later, we'll have a medical professional on the square to discuss the same subject of sickle cell disease. In the meantime, lady and gentlemen, you're welcome to the square.
Thank you for having me.
And Fatima, I must say that, you know, your title is just appropriate for surviving the condition up until now as an SCD warrior. But share with us your journey with sickle cell disease. How were you diagnosed, and how has it impacted your way of living?
I come from a family of sickle cell disease, so I think before me, there were people with sickle cell disease. So naturally, immediately I was born, I was tested to know what my sickle cell status was. So, I mean, they did find out quite early, but I personally became aware of my sickle cell status, I think, when I was about the age of 11, because that was when I first left the house and I experienced stigma probably because of sickle cell disease. And also, I became very, very aware because back at home, it was not a big deal because I had siblings who had sickle cell. And yeah, it's had a huge impact on my life generally. I think it's one of my motivating factor for, being me. I'm currently a PhD student here in Bristol, and I think it's one of the motivating factor for me. Also, it's kind of like my day-to-day life because everything revolves around sickle cell, how I have to take care of myself and also look after every other person. But so far, it has been an amazing journey. I wouldn't lie. It's quite difficult. It's a rough road, but then it's going smoothly.
I see. Patrick, my understanding is that you are also, you live with the condition. Share your own journey with us.
Yes, thank you very much. Just like Fatima stated, I've been living with this condition for 4 decades now. I come from a family of sickle cell as well. The reason we started SAMVIC was because was to immortalize two siblings, my two younger brothers who lost their life to that same fight. And I was so grateful that God has been able to keep me thus far. So I decided to immortalize them. Living with sickle cell disorder, as I would say, it's part of me, but it's a journey that I will not wish anyone to start, because the pain episode, you can never get used to the pain episode of a sickle cell patient. So far, some days, even a couple of days ago, I had a crisis. And all I do is try to manage and avoid what I needed to avoid and keep myself going. And so far, so good. I'm blessed with 3 kids and married. So I give God the glory. It's been a wonderful journey as well.
I see some, and you know, forgive me for prying, but how old were your siblings when they passed? And, how does that bring into perspective for you your own mortality, the possibility that that could also be your story at some point?
Okay, my immediate younger brother, if he was alive, he should be about 37 today. He passed away when he was 9 years. That was about 96. And the last one of the family passed away. That was April 10th, 2016. He was 14, and it was after his death. The first is Samuel, and the second is Victor, both from the Eneche. So that was how he came up with SAMVIC Eneche. So looking at me, I have always looked back each time I think about them that, what actually happened that I am alive, that I didn't go with them. Management is one of it. When being the firstborn of the family, I think more concentration came on me right from when I was a kid. So my feeding, my lifestyle was a little bit different compared to them when we started having, and we didn't actually know at first that I was a sickle cell patient, but I was well fed. I was wrongly diagnosed twice from two teaching hospitals in Nigeria. I will not want to mention their names. I was diagnosed as AS. So I was actually managed as an AS genotype person rather than an SS. It was after the death of my immediate younger brother, which is Samuel, in 1996-97, that an uncle of mine who was based in Abuja, a custom officer then, connected with Professor Charles Wambebe then, who has a research institute in Abuja. So it was then they brought the whole family, and that was how we got our genotype, genotype status, the right genotype status.
So for a long time,
I
see, for a long time, the family had no idea that this was going round in the family. Did they know when Sam and Victor died?
My dad was wrongly diagnosed as AAE, my mom as AS, from the same teaching hospital.
Oh, I see. So when Sam and Victor passed, they had no idea that was what caused.
No, Victor, we had idea that Victor was SS after my uncle brought us in 96, 97.
I see.
Later on, Victor was born in 2002, so we're already aware that yes, there's what we call sickle cell in the family, and we decided to move on by knowing his own real genotype after his birth. So, but Samuel, we didn't confirm before he died, but from all indications,
you suspect that's what happened.
Down to his dying bed, we noticed that he was an SS
as
going
well.
by how the bed arrangement is for AS couples.
I see. I want to come back to you, Fatima. Fatima, in your own personal story, you talked about the stigmatization you faced. In what form were you stigmatized? The discrimination that you faced, in what form did that present itself? Fatima, I think you're muted. Oh, we can hear you now.
First of all, I cried so much that I wanted to go to a boarding house because I wanted to feel like my elder siblings. So the first time I did stay away from my family, I had a lot of crises, and like people didn't understand what was going on with me exactly. And yeah, I didn't exactly have like people understanding me, and sometimes it felt like I was faking my pain. And then after that experience, I went to a day school where I was treated like I was a different pupil entirely. I didn't get to play as much as every other kid in school. And I was, I was told to not to go outside because it's sunning too much or it's too cold outside because you're going to fall sick, and we don't want that. And some kids don't play with me because they're scared that if they play with me or I get too excited, I'm actually fall sick. So it was a form of stigma that I experienced when I was growing up. And people were like talking about the fact that sickle cell individuals, they die when they're very young and all those things, and people are scared of losing their friends. So it was kind of really weird for me, but ultimately I did kind of overcome it. as I grew older.
I see. So I've heard both of you talk about pain, and I want to understand when you have, the crisis, as it's called, when the condition presents itself in your body. What do you experience? Because Patrick has talked about pain. Fatima, you've also talked about pain. But explain to us when you say that you have a crisis or you have pain, what does that mean?
Um, so when it comes to like sickle cell crisis, there are like two major forms of it. So there's the silent crisis and there's the painful episode. So the silent crisis, you probably wouldn't know. You just notice that your red blood cell is breaking down. So that one is definitely painless. But the painful episode is like, I honestly do not know how to describe the pain, but it's very painful. It's like someone is literally eating an hammer on your knee, like the part of your body that has the highest number of nerve endings that you can think about, and somebody keeps eating an hammer on it. That's how bad it is. It sounds like I'm exaggerating, but personally, I feel like I'm not putting it into enough context as I should. Yeah.
I see. And let me, find out from Patrick if he can put, what he experiences into words for us, like you have done, Fatima. Patrick, what can you share as
Just like
far as?
Fatima stated, there is a painless crisis. Breaking down of that same red blood cells, you can find out sometimes if you go to urinate as a sickle cell patient, the color of your urine comes very dark. You might not be in pain, but you see these colors coming very dark. That's the time where they'll tell you, okay, you have to hydrate more, take more water to flush the pain out. Now, the crisis out. Now, the painful one comes with, like me, I had, when I go through crisis, I feel pains on my shoulders, my chest, as well as my ribs and my joints. These pains are pains that you can't, it doesn't have the way you want to, there's no comparison in terms of when you want to put it in a layman's language for someone to understand. As my mom will always say, based on the fact that I say it comes like a sharp pain when we are going in for a labor, one is going in for a labor, then when a medication is administered, the pain withdraws, just like when after a delivery, the pain for labor goes out. That's what is similar, it's kind of that kind of pain when you go to rating. If you go to from 1 to 20, if you are rating this pain scores, the highest pains in the world, I think sickle cell pain falls between 6, 7. That's to tell you how high it is. So the explanation or the comparison with the kind of pains that goes on in the world, it's a bit difficult for you to come out with something like that. So it's the episode Fatima might be experiencing in terms of her pain might be kind of either higher than mine or mine higher than hers. So you can't even know how to explain it, but there is a pain going around. The basic thing is there are pains around your joints and your ribs. And secondly, to add up to what she said, your sickle cell pains also leads to loss of breath, like oxygen, and as well as organ damage, depending on how it's wrongly managed and depending on how critical the pain is. I, for myself, has undergone series of surgery. I work with a support because my two knees are damaged. As also recently, I did for surgery outside the country. That was about August last year. I've experienced a kind of what you call the MI, myocardial infarction, which is kind of similar to a kind of heart attack for medical practitioners. So it comes in various versions. You don't know what your pain crisis might lead to. So it's different, and you can't really explain.
Very well. I want to come to Fatima now. Fatima, earlier you mentioned that you were treated differently as a child because everyone was afraid to hurt you. But as somebody who lives with a condition, what would you say is the best way to interact, to engage, to deal with somebody who has sickle cell? You're muted again.
Hi, sorry.
Yes, we can hear you now.
I said personally, with somebody who has, lived with sickle cell, based on my experience, I'd say that I think I should just be treated like every other normal person, how you would relate with your friend who doesn't have sickle cell. I always say this thing that sickle cell disorder is not something that is there all the time. I'm only down when I'm actually sick. Aside that, I'm like every other person and I expect to be treated as such. So I would really advise people to, just be normal about it. It's not a big deal. Let's be normal.
Tell me, Fatima, tell me why it's important that for younger children who are in school, who are in our communities, who may have sickle cell or who do have sickle cell, tell me why it's important to treat them like they are every other child, like they are every other adult in the office space. Why is that important?
So one thing that comes with sickle cell and stigma is the effect it has psychologically. So, we are all different to start with. I think I'll describe myself as an extrovert. So it's kind of easy for me to, even when I'm treated in a different way, I still find a way to, be up and about. Some people are introverted or ambiverts. If you have a situation where they're being treated separately, it could sort of cause them to um, withdraw and not really do the things that they want to do. One of the things I do regret right now is the fact that I didn't get into sports as a child. I want to do sports, but I can't see myself doing it because I am not used to it. It was something that I was prevented from doing because of sickle cell disease. So some of these things might affect the it might affect their social life, how much impact they end up having in the world, what their dreams, so many things. So I personally feel like every sickle cell child should be treated like every child so that you don't limit them, you don't put them in a box as to this is what you can do and this is what you cannot do. I think you can do anything you really set your mind to.
Well, Patrick, in places like Nigeria, Ghana, and perhaps you may have more knowledge of Nigeria, tell us how widespread the knowledge of sickle cell is in this country.
Now, the knowledge of sickle cell is still not widely spread. It's part of the reason why SAMVIC started to create advocacy and give more awareness to sickle cell anemia disorder for people to know. I'll tell you one thing. In 2017, when we started this, I had some of my guests when we were launching SAMVIC that came around who were planning to get married who didn't know their genotype. And they were not bothered to try that. So if you look around in Nigeria, some will tell you they might want to make it a spiritual thing. Some will tell you they are aware there's a way they are going to do about it, and there is no way about you getting rid of sickle cell. The only way it's for one to be able to know your genotype and do it right. And that is the problem we have currently. I think from my research in 2017, there are more than 40 million carriers in Nigeria alone. Not to talk of Ghana nor Cameroon and some other. And this is a kind of Nigeria has the highest carrier in the world, and also sickle cell.
Nigeria has the highest carrier rate. Do you think that the disease is taken seriously?
Yes, in every newborn in Nigeria, in every 100, I think in 2014 there was a message, a documentary about it that in every 150 babies born, there are a sickle cell patient, about 2 or 3 are being noticed.
I see.
Also, that was when we also had it that about 40 million Nigerians are carriers, if going by research.
Very well.
Now,
I want us to.
Sorry, please. Currently, we don't promote. A lot are not promote. They are not willing to have a ASAA marriage. some people want to go ahead and do an AA marriage. And the best thing we have to eradicate anything that has to do with sickle cell anemia in the family or in the country or in the world is for us to pair genotypes that are okay to be paired in order to reduce the number of carriers in the country and globally. So awareness needs to be done more for people to know. I'll tell you honestly, we don't have much awareness about sickle cell because some people, what do you want to talk about?
Well, when I come back, when I come back, I want us to also look at the fact that perhaps people are afraid to know the truth. And yes, and we'll just discuss a bit more about that. And maybe Fatima and Patrick, you can tell us, what you put on your checklist when you were looking for a partner, So perhaps some people can learn from it. We'll be right back here watching The Square. It's World Sickle Cell Day, and today on The Square, we're putting the spotlight on this disease that many people across the world have it, many of whom do not know their status, and why it's important for you to know, why it's important for us to have systems to support people living with sickle cell disease. With me here are Patrick and Fatima, and they've been sharing their personal stories with us. Now, Patrick and Fatima, I was saying earlier that perhaps people don't want to get tested because they are afraid to know. Do you think that could be the reason, or there could be much more than, just that, the reason people do not like to get tested?
Personally, I think it's like an healthy mix of people are scared to know, and they also don't really know the importance of why they should know their genotype. With sickle cell, I think one thing that is most common is the fact that in Nigeria and pretty much every African country is people do not know so much about sickle cell, and some people just don't see the reason why they have to know their genotype, unless, of course, they have a direct relative or a friend who suffers from sickle cell. They see no need why they should be interested in sickle cell to even start with. Going forward, with the issue of people being scared, yes, people are really, really scared of the potential that they could have the sickle cell, trait, and there's a potential that they pass it on. So they would rather not know, because Africans have this mindset of what I don't know can't kill me, basically. So they just try to I'm not even going to bother to check my sickle cell status.
And so, Patrick, what would you say are the consequences of not learning what your status is?
I didn't get that.
I'm asking, what are the consequences of not knowing your status, as a person?
Yes, the consequences of not knowing your status is, one, you are trying to bring into the world children that are going to suffer perpetual pain all through their lives. During the time where we had us, our parents were not as exposed to information as we have now. The internet is coming out with a lot of information. People are sharing things. Some people volunteer to share on social media and say, know your genotype before you get married. Churches are announcing it, and also once you pay deaf ears to all this awareness and decide to go ahead, the consequences is that you are actually being selfish and also trying to bring into world children who are suffering. It's just to a little bit go back on what Fatima said earlier. As a sickle cell patient, it's not just the pain. There's a lot of stigmatization all over. You'll find stigmatization around people who you live with or you play with, even in the medical facilities around, and some medical practitioners tend to also look at you as maybe not a child but created by God, or someone who came to the world. It's like being a punishment that you are having this sickness. Some people feel that it's your fault that you have it, and some things like that. So it's better people know their genotype and avoid it now, to avoid such problems coming up for their children. And also, You see some people running away from marriage when they see that it becomes difficult. We are lucky that we have parents who sticks together in terms of this kind of situation to be able to even see us through. Sickle cell is expensive to maintain. So I tell you, it's not something that anyone, even my worst enemy, I won't advise you to go into it.
I see. We are now joined by Dr. Joseph Minari. He's Associate Professor at the Department of Cell Biology and Genetics at the University of Lagos. Dr. Minari, thank you so much for joining us here on The Square. We've been talking about sickle cell. We've been waiting for you to join our conversation. What is sickle cell? What is it all about?
Thank you very much. I've been following all along. I've been listening to Fatima and Patrick for their wonderful contributions. Thank you very much. When you talk about sickle cell, we're actually talking about a disorder which generally is known of the red blood cells, to be specific, the hemoglobin, the beta globulin part of the hemoglobin. On the hemoglobin, we have the alpha and the beta. So it's the beta globulin part. There is actually a mutation that's actually happened there, where you're supposed to have a gene coding that's supposed to code for an amino acid, glutamic acid, being substituted by amino acid valine. Glutamic acid is an amino acid that is acidic in nature and that is hydrophilic. That means can appreciate water, can dissolve in water. But valine, on the other hand, is hydrophobic. And that is why when that mutation occurs on that particular gene, on the beta globulin of the hemoglobin, it causes the hemoglobin of the globulin of the hemoglobin not to be able to dissolve properly in water. And that also brought about the sickle shape that you actually see, and that is why where you derived that name, the sickle cell. Actually, when a child is given birth to, you carry the HbF hemoglobin, and it's expected that as you grow, you're supposed to have the HbA, the adult hemoglobin. But in cases whereby you have that mutation, which can also be inherited, that particular incident of that mutation confers that sickle cell disease to that particular person. It's a disorder actually that happens at that genetic level.
So Doc, you know, in basic, in English, for us to understand, you have told us the medical term, right? In English, for us to understand, you say there's an attack on your red blood cells, which means that you are always short of red blood cell. Is that it?
Well, that's a layman's language,
yes.
really.
Yes, that's what I mean. You know, I'm just trying to make sure that I understand you.
Okay, yes, I'm trying to also break it down as much as I could. It's not like an attack like that. What happens is that the normal hemoglobin that's supposed to be in the body with that glutamic acid, supposed to be stable and supposed to be able to dissolve in water, because 70% of your blood is water. So, but when you now have it that it's sickle shape and it could not dissolve in water, you know, normally the red blood cells are supposed to be a disc shape. Now you're having a sickle shape, making it very fragile. Indeed. And that's why it's very easy. It's not very easy to break up those cells, can easily break up, and then subjecting that person to different kinds of symptoms that you actually eventually observe. That you actually, maybe if you say a break, maybe for people to understand, maybe yes, I can go with that as well.
Indeed.
And
so
historically, okay, want to say something?
Yes, I did. I want to ask you about newborn screening, which is one of the things that could help with catching, you know, those who have it early and improve their survival rate. How would you say, you know, what's the state of newborn screening in a place like Nigeria?
Okay, well, it's not, we are not where we are supposed to be, but can assure you we are also not where we used to be. There is a little bit more of an awareness. I think one of our PhD students once worked on it, and we also have some issues even in terms of the diagnosis at that early stages, but there is more awareness than what it used to be, because what it used to be when people people couldn't manage it, and sometimes they thought that, oh, it's one spiritual powers that is actually dealing with them, not knowing that it's just a natural phenomenon that was actually inherited. So, but we can also do more to increase the awareness. Even though, as we speak now, one of my core areas that I'm researching on is on gene editing. As it stands now, there is a promising way out now to actually be able to treat the carrier of the sickle gene effectively well now, and then the person will be very, very well. It has gone through clinical trials and is doing well. I think soon as is going to go around the world as we speak.
I see. So, doctor, for somebody who has sickle cell disease, we know that there is no cure at the moment, you know, except for this gene editing you have just told us about. In what ways can such a person cope? What are some of the things that are in place now that help people to boost the survival rate?
Well, I think what can help now, you work closely with your doctor and make sure that you follow those guidelines strictly, watching your diet, watching the level of stress, avoid the crisis as much as you can. And then you also need a very good support system. Like I think Fatima and Patrick also said, even in society, we need to encourage support system. That stigmatization should not be there. We are all human beings and God has created us. So let's, if we're able to do that, if you have a very good support system in the place of work, at school, and at home, and that can actually come when there is enough awareness also. The intensity on awareness needs to increase at home. Let also people know what to do in the society, let people know what to do, and also educate even the carriers as well to also know what to do. Immediately you are feeling something, you need to let your doctor know. So that you quickly know, okay, this is what you should do. We've seen people that actually was able to manage theirs all through. There's one of our senior colleague, a professor, who is a carrier, and in fact, at the point she was even a dean on a faculty.
I see.
She was able
Speaking
to
of knowing
well.
what to do, I want to take that to Patrick and ask you, what do you require from the medical society, from health professionals, from the health community, from your own community, wherever you live as a carrier of the sickle cell disease gene? What do you require to ensure that you're comfortable, to ensure that you are okay as far as your survival is concerned?
Okay, thank you very much. I think from one of the problems we have is the environment that affects sickle cell patients. I live in Abuja. A sickle cell patient does not require to have to live under extreme temperature. It shouldn't be too cold and it shouldn't be too hot, just like Dr. Joseph mentioned. You have to avoid stress, and also it's advisable a sickle cell patient see a hematologist than a physician. I've been managed by hematologists for years. Before I traveled, I was managed by a physician. I lived outside the country for about more than a decade and a half before returning to Nigeria in 2019 as a result of COVID. All through my stay outside the country, I didn't come down with crisis. So, and I believe Fatima too should bear me witness, since she's speaking from the UK. She can compare her normal crisis in Nigeria with that of the UK. There will be, I think there is a serious difference or a tremendous improvement when it comes to going down with crisis. So I think first thing, we have to work on our environment. Secondly, our medical system. Hematologists has to be on ground in all clinics. It's very few for you to have in most of the medical facilities, just in Abuja, which is the federal capital, you have few resident hematologists, which I can even count them because I research about these people to be able to get better medical care. Then drinking of water, hydrating yourself, staying off what is you are not supposed to do to keep you going, not to avoid things.
Indeed, indeed. Gentlemen, I'm afraid we'll have to leave our conversation here. But before I let you go, Doc, if you could quickly tell me what causes the pain that they feel all the time? Patrick has mentioned it, Fatima has mentioned it. What causes that pain?
I think the pain is linked to what I told you initially.
Right.
You know, the blood generally is the one that's supposed to convey through the hemoglobin, that's supposed to convey oxygen around the body. And when at this point that most of the cells are already damaged or broken down, and then you don't have enough even oxygen around your body, and
Right.
those oxygen actually uh, play a major role in actually generating a lot of energy and a lot
Mm-hmm.
of strength that is needed. So some of these cumulative effects, will begin to form different defects that result to pain at
I see.
various joints and the various parts of the
I
body
see.
that they will
I'm afraid,
begin to
I know
experience.
there's much more to talk about, but I'm afraid we'd have to leave our conversation here, unfortunately. But I do appreciate your insight on the subject matter, Patrick, Fatima, who is no longer on the connection with us, and Dr. Minari. Thank you so much. Patrick, thank you for all that you're doing, and we wish you many more pleasant years. Um, That'll be all today. But for you at home, remember that our discussion today is not substitute for medical advice. If you believe that you have sickle cell or you have tested and you're positive, your hematologist is always the best to go to. At least in the worst case scenario, see a physician. But that'll be all today. Thank you so much for your company. I hope to see you here same time tomorrow. I know it's also Juneteenth today, and we want to recognize our brothers and sisters in the diaspora. Thank you for watching. I'll see you same time tomorrow. Bye.